This Medical Halo weekly update covers key global pharma developments for North American and European healthcare professionals and industry stakeholders, focusing on regulatory actions, market launches and late-stage pipeline progress. Innovator therapy regulatory actions. The FDA expanded tirzepatide's indication to treat obesity in adolescents aged 12-17, supported by phase 3 data showing a 17.5% mean BMI reduction versus placebo. It is the first GLP-1 agonist approved for pediatric obesity in nearly a decade. The EMA accepted AstraZeneca's marketing authorization application for Dotopot AMABD or UX-Tecan DXD, an antibody drug conjugate for advanced and SCLC, backed by positive phase 3 trial data. A final decision is expected in Q1 2027. Vertex's VX548, an oral NaV1.8 inhibitor for acute pain, received FDA breakthrough therapy designation. Phase 3 results demonstrate significant pain reduction with a placebo-like safety profile, positioning it as a promising non-opioid treatment option. Generic biosimilar developments. Teva secured final FDA approval for its generic cariprazine capsules, all strengths of reference VRAYLAR, indicated for schizophrenia and bipolar I disorder, with immediate commercial launch. The reference product generated approximately $3.2 billion in annual U.S. sales through May 2026. The European Commission granted 8 centralized generic marketing authorizations last week, including generic Lenvat-ini band 8B Remilast. These approvals enable access across all 27 EU member states, with expected price cuts of 40–60% to reduce healthcare system costs. The FDA approved Celltrion ustekinumab biosimilar CTP43 for all eligible indications of reference Street Elara, scheduled for Q4 2026 launch. The EMA CHMPISSUEDA positive opinion for Biogen's Bev-Acizum AB biosimilar by 695502, with a final EU decision due late 2026. Late-stage pipeline highlights. Pfizer announced positive top-line phase 3 results for its bivalent RSV prefusion FVACC-INE in adults aged 60 and older, achieving 86.7% efficacy against RSV associated lower respiratory tract disease. FDA and EMA submissions are planned by the end of 2026. Gilead's magrolimab plus as acididine met the primary progression-free survival endpoint in a phase 3 trial for higher-risk myelodysplastic syndromes. Full data will be presented at a forthcoming medical congress, with regulatory filings targeted for 2027. Industry policy updates. Sandoz expanded its European oncology generics footprint with launches of generic pomalidomide, ibrutinib and palbociclib in Germany, France and Spain, with rollout Street O 12 additional EU markets by year-end. The UK MHRA launched a fast-track approval pathway for generics and biosimilars, reducing review timelines by up to 40% while upholding safety and efficacy standards to accelerate patient access to affordable therapies. For daily breaking pharma news, in-depth regulatory analysis and global market intelligence,
visit 网址